You're listening to an event from the U.S. Institute of Peace, part of the USIP podcast network. For more information about our work around the world, visit usip.org and check us out on social media.
Good morning and good afternoon. My name is Mona Yacoubian. I'm the Vice President of the Middle East and North Africa Center at the U.S. Institute of Peace. It's my pleasure to welcome all of you to this very important webinar marking the one-year anniversary of the catastrophic earthquakes that hit Turkey and northwest Syria. 1 year ago today, an earthquake measuring 7.8 on the Richter scale hit southeastern Turkey, northwestern Syria. Some 59,000 people were killed. At least 6,000 people were killed in Syria. It affected one of the most vulnerable parts of Syria, Idlib Governorate, where some 4.5 million people, many of them displaced multiple times, were living. The earthquake had the effect of exacerbating an already extremely dire situation on the ground in Syria. Today, we are joined by an esteemed panel who will help us understand both the immediate impacts of the earthquake, where Syria is 1 year since the earthquake, and what we can expect going forward as the country continues to contend with many, many challenges. I'm happy to welcome Dr. Mufaddal Hamadeh, who is the president of the Syrian American Medical Society, or SAMS. Based in Chicago, Dr. Hamadeh is a practicing physician. He's board certified in medical oncology and hematology. Dr. Mufaddal arrived in Turkey less than 1 week after the earthquake to assist with relief efforts. Dr. Bachir Tajaldin joins us from Idlib in northwest Syria. He is SAM's country director for Turkey and Syria. He's a medical doctor with a master's degree in internal medicine, and he's been working on the humanitarian response in Syria since 2012. Alex Mahoney is the division chief for the Middle East and Levant with USAID's Bureau for Humanitarian Assistance. He helped lead BHA's response to the Turkey-Syria earthquake from Washington, D.C. as BHA's Associate Response Director. Alex has been involved deeply in USAID's humanitarian response in Syria since 2011. What we'll do, I'm going to engage our guests in discussion for about a half an hour or so, and then I'd like to bring in questions from all of you tuning in online. Please note you can ask your questions in the chat box that appears on the event page. So with that, Dr. Mufaddal, I'd like to start with you. Maybe first say a word or two about SAMS for those who may not be familiar with SAMS, and then maybe talk about your own direct personal experience having traveled to Turkey just after the earthquakes.
Thank you very much. I appreciate this opportunity. SAMS has been working in Syria since the war started in Syria over 12 years ago. Initially, SAMS was established in 1998 as basically a medical society organization that has roots in Syria and tried to help the Syrian people in education mainly. It was more like a social club. But after the war started, SAMS transformed itself into building a network of healthcare providers inside Syria during the most difficult days and times of war. So we helped build field hospitals. We supported the staff that are helping the victims of war. We helped establish essential needs clinics and field hospitals. We even built underground hospitals to protect them during the days of war. We built cave hospitals. So we have a vast experience in going through all those stages of the war, supporting our staff, supporting the doctors, supporting hospitals, building clinics. So, you know, our staff are very well used to war, destruction, collapse of buildings, used to receiving very sick and critical conditions of war. So the earthquake came, and it was basically an exaggerated experience for them. And they've never seen anything on that scale, that big, before. In addition, the earthquake itself was the scariest thing they ever experienced, as many, many people told me. It was much worse than the barrel bombs they faced, more worse than the chemical weapons attack that they were subjected to. The fear that an earthquake can instill in your heart and body and mind is nothing like you can ever experience in your life. So a lot of destruction happened in a very vulnerable area, as you have said before. Basically, these are, an area that is underserved in terms of healthcare infrastructure. But our experienced staff and dedicated staff worked day and night over the ensuing, 24 hours after the earthquake and the days after. And they've done a remarkable job of saving as many lives as they could. Obviously, for us here living in the U.S., the leadership of SANS was extremely concerned, knowing how much of a dire need they need, how much help they need. So we established a warehouse immediately and received tons of donations from a lot of people. And then our team, our president then traveled to Syria the next day, and he met with the local leaders there, mainly the White Helmets and the Syrian Forum, and they formed a kind of a union to work together and to try to help solve the problems. That was very effective immediately after the earthquake. So we had to, we were able to provide some help and needed equipment, but that was a trickle of the need that they needed at that point. One thing is notable is the first international aid arriving to Syria was over 7 or 8 days after the earthquake. Very sad, because the Syrian people were practically left alone. They were left to their own devices. Luckily, with the help of the White Helmets, who had a great experience in recovering after collapsed buildings, and the help of the community providing all they needed in terms of heavy lift equipments and that stuff, helped save many lives. One thing that happened that after I talked to the White Helmets, said we were done removing people from underneath the rebels much sooner than the Turks. And for one reason is we don't follow safety standards. We go in, we expose our lives to danger, we are ready to sacrifice our lives to get the people out. So they were, and that's how they used to do it for over the last few years. Anyway, so we had a great, the infrastructure we built, even though this whole experience exposed many, many gaps in it, but it was strong enough to be able to withhold a few days and help save many lives as they can. We arrived there, obviously, we got to the hospital. We met some of the victims that were there, and I can't forget the few moments that was extremely emotional for us. The one thing that surprised me more than anything else is how numb people were. I'm looking at the victims and seeing the people, the children who lost everything, lost their parents, and my tears in my eyes, and everybody else is very numb. And I experienced that before when I went to Syria after major events, after bombardments. And it was sad to realize that those people in Syria got used to tragedies. It's not new to them. It's a normal life for them, as if death, destruction, and loss is their normal life. And it's been that way, unfortunately, for the last 12 years. Moving forward, I think the earthquake had a lot of good effects. And it's silver lining, we can say that. As on one hand, we've seen a lot of help from the international community, from especially the American community here. The donations poured in, And we were able now to establish medical missions going to Syria every month since the earthquake. And I just was on the 12th mission, medical mission since then. That opened up the borders, and we've seen some of the gaps in there that we were able to fill now, and we can talk about it more. So we have enough money, we have enough support now to build a brand new hospital, a brand new cancer center, a brand new radiation oncology center, and we have a dream now to build a sand city that after we bought over 12-acre land, and we're started the construction process now. So there are new things that are coming up, new teaching opportunities, and new training opportunities that are opening up for now, and we're working on it. Unfortunately, I visited Jindaris, the area that was hit the most since the earthquake. The rebels gone, but no construction started. The tents that were erected there, the refugees are still there, and their condition hasn't changed much. Thank you.
Thank you so much, Dr. Mufaddal. You've unpacked quite a lot that I want us to dive into more deeply. We are going to turn back to certainly where things are today, and also how organizations like SAMS are thinking about engaging on these many challenges going forward. I would, though, like to turn to Dr. Bachir at this point. And Dr. Bachir, you are joining us from Idlib. Where were you when the earthquake hit? It would be, I think, for someone that experienced it directly, I think it would be helpful for our audience to understand the enormity of that earthquake, and then understand from your perspective there on the ground how you were able to mobilize. I think Dr. Mufaddal raised a very important point that it took 7-8 days before any sort of international assistance made its way into Syria. And so I think it would be useful for us to understand from your perspective there on the ground what that situation looked like and how you were able to mobilize and also work with the White Helmets. Dr. Mufaddal's mentioned the White Helmets, Syria's first responders who operate in opposition-held parts of Syria and do enormous work saving people from barrel bombs and other things. They, of course, as first responders, then turn to earthquake rescue, search and rescue. So please fill us in on how it was from your perspective.
Hi, good morning, everyone. Usually I'm based in Gaziantep, and I was in Gaziantep when the earthquake happened. Usually, as any normal day, was sleeping, preparing to wake up and say goodbye to my children and kids going to their schools, and I start my work, going to the office. But unfortunately, at that early morning, it was cold weather, and it was alarming to a snowy storm in the city and southern of Turkey as well. Unnormal. We woke up about 1.5 hours earlier than we supposed to wake, but everything around us was shaking. Unconsciously, me and my wife moved directly to the kids' rooms and making sure that they are okay, taking them and taking them out of the house. At the street, we found hundreds of people, our neighbors, just in the cold weather, in different uniforms, and just staring at and trying to recognize what's happening. A lot of children were in the cold weather. So directly, as well, as soon as we are in the street, start to communicate with my colleagues. I'm working with the team of about 200 staff responsible to also supervise and support more than 2,000 staff in the health facilities in Syria, where we are implementing our program. So also making sure we have communication with everyone, but really at that first 30 minutes or 1 hour, we start to receive a lot of tragedies. I'll summarize it with one story where one of the hospitals manager, one of the biggest hospitals manager in Idlib in northwest Syria, was trying to, I communicated him asking what the needs they are, what the cases they are receiving. He was at that time in Idlib at the hospital while his family, his wife and 3 children, including 1 newborn kids around 1 month age, were based in Antakya. Mm-hmm. And he just told me that I get some news that our neighborhood have been destroyed totally. So please make sure you are communicating with my family. We have a lot of cases, hundreds of cases at the ER department. We need to respond. So please, it's your responsibility. Just make sure that my family are okay. So at that time, you can manage that balance between doctor who is trying to help people who have been affected by the earthquake in Syria, while his family are living in Turkey, and they are in also one of the most affected cities and communities. Unfortunately, at the next day, the rescue teams could find his 2 daughters, while he lost his wife and his newborn kid. And then he continued his work. And this is the situation of all the health care providers, including physicians, nurses, midwives in northwest Syria. On the other hand, on the other part of the borders, at the first 2 nights, we spent the nights in the open settings, in temporary shelters, in cars. So we have almost about 85 staff members here in Gaziantep office, and they need to respond to the crisis. So they were trying to communicate with the partners, donors, with the field around the time to make sure that they are providing the support while their families are in need for them. Today, after 1 year, also I woke up early to come from Gaziantep to Syria. Also, I woke up at 4 a.m. And after a few minutes, I just checked my laptop and start to receive hundreds of notifications of friends and colleagues who are recalling and remembering their beloved persons and their colleagues who have been lost last year. Still big trauma to the people, especially in Syria. I went to Genderes this morning to participate in an event that has been organized by the White Helmets, and they also presented a video about their response in the first hours. Beside me, there was one of my friends who started to cry as soon as he watched the video, because himself, he was helping in the rescuing teams, and he lost 17 members of his family. Unfortunately, like Dr. Mufaddal mentioned, Dr. Mufaddal was in Syria last month, and today still a lot of construction work needs to be done. Genderes, as one of the most affected communities in northwest Syria, still have a lot of distracted buildings, and on my way from Genderes to Idlib, which is about 2 hours driving, there are a lot and tens of thousands of informal shelters and tents on both sides of the roads. Although the consortium and union we worked on along with the White Helmets and Syrian Forum directly after the earthquake. We provided some infrastructure construction like the main roads to facilitate access. We, with our partners, start to rehabilitate the affected schools, or some of them, trying to improve the health infrastructure, but really still maybe hundreds of thousands or millions of people and children are or don't have access to education, don't have access to healthcare services. And during the last year, although there are a lot of support done, but it's really very minimum compared to the needs, especially when we know that before the earthquake, there was the cholera outbreak. Before that, there was the COVID outbreak. And after the earthquake itself, the escalation took place in the area on October last year, resulted in additional 120,000 displaced people. Also, the acute shortage and decreasing of the humanitarian funding to Northwest Syria, including the big cut of the WFP program, and that will start to threat the food security. So unfortunately, after 1 year, still a lot of work is needed, and really the needs are increasing day after day. Now we are reaching the highest number of people in need in Syria, mainly in northwest Syria. So it's again an open call for all of us to increase our participation to those people in need. Thank you.
Thank you, Dr. Bachir. I wonder if you could just, in the immediate aftermath of the earthquake, could you speak a little bit more about the role of the White Helmets? Because I think folks should understand that these first responders really played a heroic role in the absence of any sort of international assistance, at least again in that first week or so. What was your sense of what role the White Helmets played in terms of search and rescue efforts?
Actually, the White Helmets teams, I can, as I told many of them today when I met with them, you are doing exactly what the midwives and the obstetrician is doing. You are taking the new lives, but not from the womb of a woman, but you are taking those lives from under the rebels. They have very limited resources. They didn't receive the support of those heavy equipments usually used in such disasters, but they really used their willingness to help the people, using their hands, their simple tools, just to save whatever they can save. And they, at least in the first 5 days, they worked around the clock. They didn't stop any minute. They are just like the doctor I spoke about him, who lost his wife and his newborn kid. They are the same. They lost their family members, but they also continue to rescuing lives and provide the support, taking the injured people from under the rebels and referring them to the health facilities to be treated. So without their contribution, the healthcare worker could not also provide or continue the life-saving services. So this is in brief their initial work at the very critical phase. And then in the second phase, they start to open the main roads. So the other sector could go and provide the services and assistance to the population in the collective centers or in the settlement camps or informal settlements. And their third phase was to removing the rebels. So they played and still are providing a lot of important work.
Thank you, Dr. Bachir. Alex, if I could turn to you, maybe you could provide some insight from your perspective at USAID, sitting in the Bureau of Humanitarian Assistance, in terms of what were the challenges that USAID was faced with in the immediate aftermath of the earthquake, particularly, again, trying to get assistance into Northwest Syria? What were the unique challenges that you all found yourselves confronted with in that situation?
Sure. Good morning. First, let me just say thanks, Mona, to you, to USIP and SAMS for hosting this event. I think it's really important that people continue to recognize that Syria remains a major humanitarian crisis, and it needs our continued attention. I'll talk about the challenges, but I first want to talk about how we responded to this immediately after the earthquakes hit Turkey and Syria. We mobilized a DART, that's a disaster assistance response team, which is a team of specialists that are trained to respond to disasters around the world, and that included a large urban search and rescue component. So our response focused from day one on both Turkey and Syria. The DART comprised more than 200 staff at the peak, and that included incorporating an existing team that we have for Syria that operates out of Turkey and Jordan to help respond to the ongoing crisis in Syria. The assistance we provided for both countries totaled more than $242 million, and that was for food, health, shelter, water, sanitation, and other life-saving support. With that support, for example, the UN World Food Program has reached 2.7 million people with hot meals and food rations, as well as with multi-purpose cash assistance. We brought in the days after the earthquake, 10 flights with nearly 1.8 million pounds of relief supplies for both Turkey and Syria for onward distribution through the International Organization for Migration. And we also partnered with our Department of Defense to transport nearly 600,000 pounds for newly displaced people, again, both in Turkey and Syria. In Syria, our partners distributed critical medical supplies and provided mental health and psychosocial support. Speaking specifically for Syria, we provided more than $170 million to both UN organizations and non-governmental organizations working in the northwest part of Syria, which was hardest hit by the quake. So the World Food Program, for example, reached 2.2 million people with emergency food assistance. And I should also mention that our support immediately following the earthquake included funding to the White Helmets to help them with their heroic work. They are an ongoing partner of USAID, and right in the aftermath of the earthquake, we gave them an additional awards to help their rapid response. In terms of challenges, I would say the top challenge, well, there were two. One is common in any earthquake, which is that the people who are there to respond are often also directly affected by the quake. So you heard already from our SAMS colleagues about staff whose families suffered losses, and many of our partners experienced the same. I had to sign many condolence letters for partner staff who died as a result of the earthquake. This also affected the Turkey side, and importantly, it affected staff and infrastructure at the border crossings, So that was one factor in aid access. But I would say the biggest factor, and this remains an ongoing issue, is just the tenuous nature of access into northwestern Syria. So about a week after the earthquake, the regime granted access to 2 additional crossings, in addition to Bab al-Hawa, which was already open to UN agencies. They added Bab al-Salam and Bab al-Rai, which was welcome, but a week after. And recently they reauthorized Bab al-Hawa for another 6 months. But what we really need to see is ongoing access, and that didn't exist. The White Helmets did amazing work in the days and hours after the earthquake. One of the characteristics of search and rescue operations is you must begin to work immediately because people cannot survive long buried under rubble. So they were able to do that, but really there should have been more organizations, and it was just very, very difficult for search and rescue requires teams of hundreds of people and heavy equipment, and getting that in was extremely difficult.
Yeah, thank you, Alex. Thank you for both the descriptions of what you all were able to do, but also these challenges. And I'd like to sort of come back to you a little bit on that, because it was notable, the disparity between the ability for international teams to quickly get into Turkey versus the difficulties of accessing Syria. And it sort of, for me, it raised the question of, do we need a doctrine of, the responsibility to rescue, where when there's a catastrophic event like a 7.8 magnitude earthquake, there needs to be a way to address whatever the risk issues are of engaging in a cross-border assistance mechanism, so that people in need in those precious early hours after something like an earthquake, which really means the difference between life and death, are able to access, that search and rescue teams are able to access people much more quickly. I don't know if there's any thinking going on within USAID on, should there be another such disaster in another conflict zone, how to address these kinds of almost legal restrictions that impede the access of aid immediately following a natural disaster. Is there any thinking going on at AID about that?
So this is something that we think about and work on all the time. I think what makes Syria unique is the issues around access to areas that the regime does not control. And until July of 2023, there had been a UN Security Council resolution for at least one of those crossings. One of the things that we have advocated for is that we need to see those crossings formalized again through a Security Council resolution. Right now, access remains tenuous because it's dependent on the Syrian government continuing to agree to permit aid to come through. So I think that's the most critical aspect of it. In most countries, there is an understanding with governments that when something catastrophic like an earthquake happens, you need to get bureaucratic obstacles out of the way, and allow teams to come in and allow them to do their work. So it's rare that we see challenges like we did in Syria with just days and days needed for substantial aid to get in. So I would advocate revisiting those resolutions, most importantly, but ultimately there also needs to be an enduring political solution to the conflict in Syria. This comes in the context of a humanitarian crisis that has lasted over 10 years and has left people incredibly vulnerable, which also contributed to the difficulties in responding to the earthquake.
Thank you, Alex. Dr. Mufaddal, I'd like to turn back to you. You've been making several trips back and forth to Syria, and I want to understand, how SAMS is prioritizing where does the greatest need lie? And in particular, I think I would highlight, as Alex has also alluded, we're seeing actually humanitarian need increase in Syria. The numbers of people who require humanitarian aid has actually increased in 2023. We have issues, as Dr. Bachir mentioned, of schools being destroyed by the earthquake and adding to the number of Syrian children who are out of school because there aren't schools to go to. There's just enormous need, and not to mention, as I think you noted, the reconstruction from the earthquake sounds like has moved at best quite slowly. So when SAMS is looking at this kind of wide range of challenges, how do you think about how to prioritize where and how to engage, understanding that you are primarily a health providing organization, but how do you think about it in the context of the much broader need that is evident in Syria?
Yeah, thank you. It's a $1 million question. But before I start answering this, I want to take this opportunity to thank USAID for all the support they have given us over the years and the extra $2.2 million, I guess, after the earthquake. Their support has been essential in maintaining our function and work in Syria, northwest Syria, over the years. Going back to the question, when I was asked once, what do the people in Syria need the most at this point? And my answer was hope. Yeah. I think the problem is with Syria is the problem, the uncertainty right now, the uncertainty that has been going on for years. We enjoyed a relative calm for the last 2 years, and many changes happened with that relative calm in the last 2 years. So if we can be assured of a future, then people can start thinking about building their future. The most heartening thing is when you ask a child in Syria, what do you want to be when you grow up? And he says, nothing, because I have no future. So this is the most important thing for the people now, is to believe in a future. And from the healthcare-wise, and health infrastructure is, I think one thing that is missing, and I think that needed the most right now, is psychosocial support, psychological support to many people. I mean, the Syrian people are probably the most resilient people that I've ever seen and I witnessed in my life. I have never seen more resilient people than the Syrian people, but you keep on relying on their resiliency, it doesn't work anymore. There has to be some more psychological support. Children is the biggest disaster for Syria over the last 10 years. I call this generation of children as the lost generation. They lost school, they lost their friends, they lost their families, they lost their communities, they lost their support, they lost everything. We see many children working now, and they left school because they can't find enough to eat for schools. Mental health for children, children with disability is a big thing that we're going to try to work on. Many children with disability, whether mental, physical, and psychological, a lot of those that we're started working on. For healthcare-wise, we need healthcare infrastructure. The hospitals we have now, we're supporting. They're doing a tremendous job. We're building new hospitals, renovating new hospitals. That's not enough. It's time for us to build quality healthcare services, quality constructions. And that's why we're working on training doctors. We have fellowship programs. We have residency programs. In the whole entire Idlib, there's Northwest, there's only one psychiatrist. There are no pediatric oncologists treating cancer patients. So we are training pediatric oncologists. We're sending them to Jordan to train at King Hussein Cancer Center. We graduated 2 new hematologist oncologists so they can treat cancer centers. There are certain diseases that are not covered by aid, they're not covered by grants. We had to dig into private funds in order to cover the cancer as a big thing. And that was a very vulnerable thing when the borders with Turkey were closed. People's lives were endangered, and cancer patients found no way to get cancer. Now, because of expanding our cancer program, our oncology program, we're getting some grants for medical oncology, for kid care, for drugs. We'll be able to provide more people with the care they need at home. They don't have to travel to Turkey to that. So that exposed many things. And immediately after the aftermath, dialysis kits were missing. We didn't have enough dialysis kits. We didn't have enough dialysis machines. With crushed wounds, injuries, many patients went to renal failures, and that was the biggest problem initially after the earthquake. So now, with the support we had after the earthquake, SANS decided that we're going to build now a new infrastructure. So we're embarking on a new hospital now. After we bought the land, we're building a 450-bed hospital. It's going to be the state of the art, and it's going to have to be American standards. It's not going to be field hospital standards anymore. It's the people of Syria and the doctors in Syria deserve better. So we're going to build a cancer center also, and we are building teaching institution that trains doctors to lift us level of healthcare services to the level that is standard worldwide. And we're getting a lot of support. The doctors in Syria are excited about it. We're getting help from the community. Moving forward, I think, we need to invest in our own communities there. 2 examples that I learned recently about how we can do that, especially in light of declining aid to Syria, is one is we just opened up a new clinic, a new small hospitals, and then a CAT scan, state-of-the-art CAT scan in a small village in Syria called Sarmin. The whole community was so excited about it. The landlord came to us and said, I don't want any more money. I will give you the land for free. I will do everything. And the whole community celebrated this new machine, and they expressed their will to do everything they can to help us expand and bring in more healthcare services to Syria. So we're going to need to change the mentality from the receiving to the giving to partnering with the community, just like happened after the earthquake when all the contractors, had the private heavy equipment machine came to the White House and said, here's our machines, they're under your control, you can, under your service, do anything you want to help people. I think that's, providing hope, stability, training people to be able to be dependent and to wean them off of aid.
It's an extraordinary effort, and I want to explore that a little bit more deeply. But you mentioned something that actually connects a bit to one of the questions that's being asked, which is you talk about building Syria, Northwest Syria is in dire need of healthcare infrastructure and building hospitals, and you said building them to American standards. And the question that's in the chat that I want to sort of pose to you, but also maybe to Alex, is apparently in parts of Turkey, those buildings that were earthquake compliant fared much better. Those buildings that were built to code, in other words, actually did much better in the earthquake than when there were, shortcuts taken. I assume, Dr. Mufaddal, given particularly now this history, and this is a an area of significant tectonic activity, that buildings that you all would build in Syria would also comply with earthquake standards. Is that something that you consider now as you move?
Absolutely. Our new design is earthquake resistant. It's environmentally friendly. Solar energy, it's all got to be incorporated together in that new building. Okay.
And Alex, do you have any thoughts on that from your perspective at AID? Did you all see a difference in how different structures fared in various parts of Turkey, depending on whether or not they were compliant with building codes?
Yes, and we see that in earthquakes around the world. Earthquakes are sometimes described as a man-made disaster because it's the structures that fall and kill people, and building codes are absolutely critical to reducing deaths and injuries. So yes, that is incredibly important. I think if you look at Syria and look at the history of the last decade plus since the crisis began, including barrel bombs and all kinds of just widespread destruction. Even buildings that were relatively sound have been made more vulnerable. So I think Syria again is in a very difficult place in terms of the soundness and safety of buildings. It is a critical issue for survivability in earthquakes.
Yeah, no, you point to a very important issue, which is, of course, before the earthquake hit, many of these buildings in northwest Syria were already compromised by virtue of having been subject to bombardment and fighting and so forth. Dr. Bachir, I want to turn to you again and see if I can have you talk a little bit more about the psychosocial needs on the ground, what you are seeing inside Syria, and even frankly among your own staff, as you noted, who have suffered enormous loss as a result of the earthquake. How are you contending with the challenge of addressing trauma, particularly with children? And are there innovative ways that you're looking to integrate psychosocial services into the care that you provide?
Yes, actually, the mental health and psychosocial support is of high need since more than a decade during the Syrian crisis. But after the earthquake, the population, mainly in northwest Syria, experienced a new modality of the psychosocial shocks, and people experienced many shocks. But after the earthquake, it was really very unique because also the staff themselves have been affected directly. So the service providers has to be who has to respond to the crisis have been heavily affected by losing a lot of relatives. And that was obvious for us because after a few months of the earthquake, we did some surveys. There is a high burnout rates among the service providers. And even within the beneficiaries, we are facing new or higher level of PTSD, or post-traumatic stress disorder, more mental health disorders. We need more needs and more disorders, mainly with the children. At the same time, we have a huge lack and a huge shortage of the service provider, mainly for the mental health and psychosocial support. Like Dr. Mufaddal mentioned, in Idlib, only there is one psychiatrist for more than 5 million population, which is hugely under standard. But also for the psychologists and psychosocial workers, usually this sector in the health system in Syria is ignored and was not very grown even before the crisis. So the needs was and still very big and huge. What we did as a first response, for example, in SAMS, we have different offices in the region. So the teams from different offices stepped in and provide the support and those peer support to the service provider that also helped a lot in relieving the stress to the provider and providing support, in addition to other initiatives. Personally, for me, I found the most intervention that helped me to relieve some stress is the flexibility provided from the leadership of the organization. So go and use all the resources you can. Don't even look after. So I have this flexibility that gives me more hope. But at the community level, because we have a shortage of staff, we already started around the earthquake some community programs. That one of them is the CETA program, partnership with some universities, the Johns Hopkins University. It's this approach is just to train the local women at the community to provide psychosocial support to their peers, women and children, which is very unique program, very useful program, and we expanded after the earthquake again. Also, on the other hand, because we have a lack of the staff, although we expand and integrated the psychosocial support in all our activities, including outpatient, inpatient, primary health care, and secondary health care, especially for the patients with non-communicable diseases and chronic cases like the cancer and the cardiac diseases. We are integrating the psychosocial support services. But on the long run, also, we initiated a long-term educational program targeting many branches of the MHPSS, including psychiatric nursing, clinical psychologists, and psychosocial worker. So we are also working on the long-term education and training program, so we can also provide the community at large with the human capacity to expand those programs and meet some of the needs. But it's really one of the very big problems in northwest Syria is the mental health, psychosocial support, stress, and also we have high rates of drugs addiction. We have a high rate of suicide as well, which is also increased after the earthquake, relatively. But the root cause also is, in my opinion and many others' opinion, is what Dr. Mufaddal mentioned, the lack of hope.
Yeah. Well, I want to, before turning to Dr. Mufaddal, because I'd like to give you, Dr. Mufaddal, the last word, I do want to turn briefly to you, Alex. You've been covering Syria since the start of the conflict. The conflict will enter its 14th year next month. And we're seeing significant issues with diminishing humanitarian aid budgets, donor fatigue, competing needs, both in the region and around the globe. The WFP, for example, is slated to phase out, I think I understand, a significant amount of its funding for Syria in 2024. From your vantage point at USAID, how do you view how to address these significant challenges in Syria going forward in an age of diminishing assistance budgets?
Thanks, Mona. That is a good question and a tough one. One of the things that we are facing, I think the world is facing, is just an era of growing humanitarian need. We've seen multiple new crises spring up in the last few years, growing numbers of people in need and declining budgets. So that is the overall context that is driving some of the reductions that you referred to in Syria. For us, what we are continuing to do, first of all, we remain committed. I want to emphasize that to responding to the crisis in Syria. But I think we all need to think about how to change how we respond, and we need to think about bringing new donors to the table to address the growing needs in Syria and worldwide. So advocacy around the world with other governments, other donors, is something that my bureau is very intensely engaged in, and trying to message the critical needs that continue to exist in Syria. That's one of the reasons I'm here today, and why this is so important that we have this discussion. So that is one part of it, and then the other part of it is there are different ways to provide humanitarian assistance. There are ways that we can be more effective and more efficient in terms of costs. So we just need to all think about that and work together more closely than ever to be as efficient as possible. I think increasing the size of the donor pool is the most important thing that we can strive for. So
I think with that, with our remaining few minutes, Dr. Mufaddal, I'd like to turn to you, because you lead a Syrian American diaspora organization that is playing a critical role on the ground in Northwest Syria. And I think in many ways you are addressing precisely the kinds of gaps, although they're enormous, that Alex has pointed to. In your just few minutes of concluding comments, could you let us sort of understand, you've given us already some different, very creative ideas that SAMS is thinking of. How do you see the future in Syria and the role?
How do we move forward? It is a very tough question, but listen, I don't want to diminish the need of aid to Syria, although, and a meeting that is focused on aid to Syria. But the Syrian people are very creative, hardworking, and very smart. Given the opportunities, they don't need aid. They can thrive. They can do a lot of good things. The biggest example of the Syrian population, Syrian people, is the Syrian American community here. This is a great community. What SAMS have provided to the Syrian people and what was able to do over the last 12 years, I don't know of any other organization in the world or in the Syrian history that was able to do what SAMS have done to the Syrian people. We treated 22 million people over the last 15 years. We saved thousands and thousands of lives. And that we're just an example of what Syrian people can do if they were given the opportunity to thrive. I think of all we need to do is try and find a solution, give them a chance to live. And of course, we keep on pouring aid and all that stuff and things. But if we were able to provide the people of Syria with hope and a chance to work, get rid of corruption, and the things that ties them down, I think Syria will not only thrive, but it will be a beacon in the area that will provide aid to everybody else. And I truly believe in that. But until we get there, we still need to support the essential needs of the Syrian people and help them build their own institutions, help them develop their own ways to help each other, to help the Syrian population be independent and be able to develop their own institutions and their own ways of doing things, so they can be able to be eventually independent. And I think it can happen, but it will require hope, stability, and believe in the future.
Dr. Mufaddal, I want to thank you for helping us end this on a hopeful note, because I think I would certainly agree with you. That is really critical for the Syrian people going forward. I want to thank you, Dr. Mufaddal, Dr. Bachir. I want to thank you and Alex Mahoney as well for this excellent discussion. Syria does not really get the attention it needs, I think, in this day, given all of the other issues in the region and around the globe. So I thank all of you for your time, and your tremendous insights in helping to illuminate where Syria is 1 year after the February 6th earthquake. Thank you very much, and thank you to our audience for participating in this very important discussion. I wish everyone a pleasant rest of your day. Thank you.
Thank you.
Thank you for listening to this event. If you'd like to listen to more events or explore our other podcasts, visit usip.org/podcasts.